think when it comes to health equity, realizing that for some people, health equity has changed its view over the past few years, and some people have different feelings about it. But for me, health equity goes all the way back to I trained in rural family medicine. And when I was approaching health equity as a practicing physician, it was about sort of the urban and rural disparities that we saw in access and in those sort of things. Later on, I went from a rural area to an urban area, and I found that you could have disparities and you're sitting in the middle of the city. It wasn't so much about geography. So for us in our organization, our work on health equity is about assessing the population that you serve. And at URAC, we're fortunate that we work with multi-state organizations, and we also work with corner pharmacies. And our standards are flexible enough to say whatever the population you serve, whether it's 2,000 or 2 million, you need to be looking at your population. You need to be measuring things within your population, outcomes, quality. That's what we expect from all organizations. And when you see differences, you need to be working to address them. So for us, health equity is not about, oh, it has to be economic, it has to be racial, it has to be gender. This is about looking at your population and addressing it. And for any organization to address differences in outcomes among the population that you serve takes leadership. You have to understand your community, and I'm a big fan of the word community, the community that you work with. And for me, a passion as a leader is to better serve my community, whether that community is, the 100 people in my organization or the 1,000 organizations that we work with. But those leaders need to understand that if you're going to be a quality organization, and for me, URAC is about an independent organization coming in and verifying quality. It's like a financial audit. We do a quality audit. And if you're going to have our accreditation for health equity, then from the very top of your organization to the bottom of your organization, they need to understand what you're doing, who you're doing it for, and how you're working to make it better. And if your leaders aren't involved in that, then it just becomes sort of the flavor of the week or sort of some initiative that we're going to do until we get tired and move on to something else. I'm going to approach this as an old doctor. So the first thing you need to do is you need to assess your community. So how are you assessing your community? What are you looking at? Who makes up your community? Who makes up your customers? Are you just going to limit to assessing your customers? Or you're going to look at the community broader. If you just as a crazy example, let's say that you're a pharmacy who's located on the third floor of a building without an elevator. And you go, we're really not getting many handicapped people who are coming into our pharmacy. So if you limit who's coming in your door, you're not going, wait a minute, we should be finding a way for people with physical handicaps to get in our door. Or if you're located someplace where, let's say you're in a underserved community, and people, can't get out of their homes. Do you offer delivery options? Do you find ways to get people, the medicines that they need? And when I was in Houston, I was part of an organization where when we looked at the Houston market, we had one area that had a concentration of Southeast Asian immigrants. And so we actually said, we need to put signage in our facilities in that part of the city that give them directions and tell them where to find things. And we need to have language interpreters and those sort of things. So it really is about looking at your community and figuring out the gaps, whether it's those who come in your door or those who can't make it to your door, and how do you address those? Now, also, cost is something, we do actually have some requirements within our health equity program about doing a language assessment. Let's make sure that our communications address a certain percentage of the population in our community. That's just good practice anyway. So that's one of the few requirements, but most of it is about looking at the outcomes and the access issues that people face as they come to you for services and finding ways to address them. I think everybody who delivers healthcare wants to do a better job, and you need to be measuring if you want to do better.